important topic.
Good afternoon, everyone. Phil Penarski here with CBS 42 Now. Hope you're all having a great day. U.S. Senator Tommy Tuberville will be hosting a COVID-19 discussion with 3 doctors from Alabama to discuss COVID-19 concerns. It appears that he is ready to speak now, so we will send you there live right now.
You as an individual can do that, you as a family. And so today, what I want to do is get 3 doctors on that really know a lot about this and give them the opportunity to speak their mind, because they're the professionals, not Dr. Fauci, not the CDC, the people that actually know what's going on in our doctors' offices, our hospitals, and what they're seeing from people out there in this great state of Alabama. So at the end of the day, we want everybody to have as much information as possible. I've had my vaccine, my family's had their vaccine, and I did it for this one reason. I did it to make sure that everybody that I was around was safe, and that I give myself and my family gives themselves the greatest possible chance to overcome this virus, because it's serious and it's ramping back up now in Alabama, and we want to make sure that we keep everybody as healthy as possible. But it's so important that you get your questions answered and just listen to the advice that you're getting ready to hear. I think that's what's most important. So I'm getting ready to have to go down now to vote on the Senate floor. You sent me up here to bring your voice to Washington, D.C., and that's exactly what I'm going to do. We've got some very important votes today, and we're up here working hard for people of Alabama, and I'm looking forward to representing you. So today, if at all possible, take from this something that would help you make an educated decision towards taking this vaccine. God bless.
Hi, good afternoon, everybody, and welcome. As you've just heard from Senator Tuberville, he feels very strongly that every Alabamian should have access to information about the COVID vaccines and should be able to make the right decisions for themselves and their families. I'm Emily. I'm from Talladega, Alabama. I work as Coach's legislative assistant, and I cover health issues for him here in D.C. Our office has been receiving hundreds of calls and questions from Alabamians asking about the safety and effectiveness of COVID vaccines. My colleague Gil, who covers healthcare back in the state, has received plenty of questions about the vaccine as well, and I'll let him introduce himself.
Hey, there we go. Good morning, everyone. This is Gil. I am on staff with Senator Tuberville. I'm the Alabama Healthcare Liaison, and I work alongside Emily. And this is just a great opportunity to express some knowledge from the frontline providers about the vaccine and COVID. So looking forward to it. Thank y'all.
Thanks, Gil. We are joined here today by 3 doctors from Alabama. Dr. Jeff Collins is an OBGYN in Anniston, Alabama. Dr. Collins has over 20 years of medical experience. As an experienced obstetrician, he sees thousands of patients and provides care for a range of medical issues involving pregnancy, including diabetes, hypertension, and obesity. Dr. Rahul Magadia is an infectious disease specialist also in Anniston. He has over 28 years of experience in the medical field, and he's affiliated with Northeast Alabama Regional Medical Center and RMC JSU Health Center at Jacksonville State University. Last, we've got Dr. Michael Ramsey, who's a pediatrician with Dothan Pediatric Clinic, where he's practiced since 1997. He attended Auburn University for undergrad and earned his medical degree at UAB. After completing a 3-year pediatric residency program at Children's Hospital in Birmingham, Dr. Ramsey joined Dothan Pediatric Clinic. Thank you all for being here. Let's go ahead and get started. So the first question is from a constituent for Dr. Magadia. They said, I got COVID earlier this year. How long do COVID antibodies last? Do I still need to get vaccine?
So typically the neutralizing antibody that you get from COVID infection per se lasts about 90 days. So you're within the first 3 months, you are somewhat protected against that particular strain. Fast forward this month or late last month, we're now dealing with Delta. So although you might be protected against that particular strain that infected you a month ago or even 2 months ago, you might not be protected against the Delta strain. So that's one reason that although you have had the COVID infection itself, we still expect that you get.
All right, the next question is for Dr. Magadia. Can you get COVID from the vaccine?
You cannot absolutely get COVID itself from the vaccine. Currently, we have 3 available FDA-approved COVID vaccine in the United States. 2 of them, Pfizer and Moderna, use a platform called mRNA or messenger RNA, and it gets translated to a specific protein that your body will produce antibody against. And the second one is a J&J vaccine. None of those 3 vaccines are capable of giving you the COVID itself. None of the 3 available FDA-approved vaccines that we currently have are live vaccines. So there's no way for those 3 vaccines to give you the COVID.
Great, thank you. That's a great response. I'll turn it back to Emily.
All right, this question is group, so I can let each one of you take turns answering it. How many vaccinated individuals get sick to the point where they need to be in the hospital? So you can kind of just tell us what you're seeing in your individual practice in terms of what you're seeing.
So I'll speak for the Dothan area. When we look at area hospitals, only fewer than 10% of the patients who are hospitalized with COVID have had vaccine. So those numbers are really low. And then breakthrough, even when people get breakthrough infection after vaccination, their symptoms tend to be much, much milder and require fewer healthcare interventions. So in our area, we're seeing that. In children, we're seeing a huge uptick in COVID cases in general. We've seen of all the cases that we've seen since the beginning of the pandemic, about 20% of them have been in the last 2 weeks. So this Delta variant, as kids are starting back to school, we're seeing a lot of young people testing positive for the vaccine. We're averaging about 40 or 50 a day in our clinic.
I will speak for the pregnant population in the Anniston area. We have seen a number of pregnant patients that have now been affected with the COVID virus, and pregnancy makes the degree of the illness worse. So we're seeing a fair number of pregnant patients who are now presenting with symptoms of the virus who are actually worse because of their immune compromised status with the pregnancy. Therefore, we're continuing to recommend and advise all of our pregnant patients, even while pregnant, to be sure to get the vaccine so that it can lessen the degree to which they will experience symptoms and lessen the degree to which they might require hospitalization. So pregnant patients are about 3 times more likely to be hospitalized if they get COVID than a non-pregnant patient would be. So we're advising all of our pregnant patients to be sure and become vaccinated so they can lessen those symptoms. Raul, you want to tell about the rest of our experience in the area?
Yeah, so currently we have 42 patients in-house. Of the 42, all of them are unvaccinated except 4. So I think our experience is similar to your experience in Dothan. So it's about 90% of the patients that we're seeing in-house are unvaccinated. It's a trend that we've been seeing for the past several weeks now, almost 1 or 2 months now, that if you are not vaccinated, the chances of you getting a COVID severe enough to get hospitalized are higher compared to when you are vaccinated. Of the 4 that we currently have who have been fully vaccinated, they have some kind of immunocompromised condition. They're taking some medications that make their immune system weaker. They have medical condition that make their immune system weaker as well. So we do have explanations for those 4 who currently are hospitalized, but unfortunately, majority of the ones that we have in the hospital, including the ones needing ICU type of care, intubated on the ventilator, are predominantly unvaccinated.
Those answers, I think that's a key insight into each area in Alabama. All right, I'm going back to you, Dr. Magadia. This is a specific question I've heard from multiple constituents throughout the state. I've heard about people getting bad chills, body aches, and swelling at the injection site from the vaccine. There are even news reports about blood clots. What do these side effects mean, and are they dangerous?
So we have seen a lot of kind of typical side effects associated with vaccine. Any vaccine, the 3 vaccines that we have currently available, and typically they last for about 1 or 2 days, sometimes 2.5 to 3 days. They're typically injection site reaction. I did have that myself, especially on my 2nd dose. That's kind of common on any vaccine that you inject the body anyway. The ones that we see a lot of are fevers. They will have some kind of bone chills the first 1 or 2 days, and we're not gonna lie to you that that the vaccine is free of side effects. That's really a lie. You will have some kind of potential side effects, but the key is they only last 1 or 2 days, sometimes 3 days, and the side effects associated with the vaccine, they're mild, self-limiting. You might want to pop Tylenol or some Motrin. You hydrate yourself. Beyond which, beyond 2 or 3 days, they will not really last. Yet to see somebody either in my clinic or in the hospital or talking to the hospital staff who have had the vaccine and they still have lingering side effects, fevers for a month or 2 months or so. I still have to see those individuals, because after 1 or 2 days, those symptoms or those side effects just disappear.
Got it. Okay. Thank you very much. We've had several questions from women specifically for you, Dr. Collins. A couple of people have written into the senator's office asking, does the vaccine affect women's fertility? Can it affect your ability to have children in the future? And is it safe to get the vaccine if you're pregnant?
Yes, those are all great questions. We get to in our office. But the reality is the likelihood of getting the virus and the sickness that goes with the virus is so much greater than any of the side effects that might be associated with the vaccine that it absolutely recommends to get the vaccine. Or as I said, they're 3 times likely to have the virus. They're twice likely to ventilate. Whereas the minimal side effects, short-lived, totally safe and pregnant. As Dr. Magadia alluded earlier, not a live vaccine. this is all that interacts with one protein on the virus, and there's no way that make the baby ill, no way to make the mother ill, and it is all of the components are proven over 20,000 vaccines to date have no greater effect than that one alluded to earlier. Site swelling, redness, a little bit of temporary discomfort, maybe a low-grade fever, body ache last a day or two. As to the fertility issue, there was a study out in California that looked at the fertility of women who have taken the vaccine. So from January to August, all of them, and there was no diminishing their fertility. So studies done, again, if you look at parts facts, if you look at the way that it works, there's no reason to expect that it would ever have any kind of an impact on a woman's fertility or her long-range chances for having children. So it's still a challenge for all of us to word out to pregnant women at any stage of their pregnancy, at any trimester, whenever they get access to the vaccine, we recommend that they go ahead and get the vaccine. Also, in terms of breastfeeding, definitely no impact on their ability to achieve pregnancy in the future or the pregnancy. So, by and large, we are totally recommended that our pregnant population be vaccinated, and it's it's a tough thing. A lot of women have preconceived ideas about the safety, about rapidity with which the vaccine was developed, but what people don't understand is that the mRNA technology has been around for over 10 years. So the reason that this vaccine was able to be developed at such a more rapid pace was because the technology was already in existence. All we had to do was plug in the protein, and that would allow it to be effective. So again, for pregnant women, for breastfeeding mothers, and fertility issues, we feel like it is totally safe for those mothers to get the vaccine early opportunity while breastfeeding.
Great. Thank you, Dr. Collins. I think there was a little bit of connectivity issues, and you summarized it there at the end, but it sounds like you're telling your patients and the people in your area that this is the right thing to do and that they need to move forward talking with their physician and getting their advice. So thank you for that. I know that's hard for women and families right now with what we're dealing with. So, all right, Dr. Magadi, I'm going to come back to you. If I'm middle-aged and healthy, why do I need to get the vaccine?
So if you're young and healthy, we get these questions a lot. I'm young, I'm relatively healthy, I don't have medical condition. Why should I get the vaccine? If I get the COVID, I should be fine. For the most part, about 85–90% of the time, that statement is correct. Mild to moderate COVID, we have seen this in younger population, but you don't really realize that there's no way to predict who's going to get that 10% who might end up in the hospital. Case in point, the youngest person that we lost in the hospital back in September, October was a 19-year-old kid. I call him kid all the time because he was a kid. He had no underlying problems. We had a bunch of patients that we admitted the past 2 weeks or so in their mid-20s. They were sick to the point that they needed to be hospitalized. Also, not only that, there is a condition called long hauler, wherein you get a long effects of the COVID, typically numbness or tingling sensation in your fingers called neuropathy. They might have problems with sleeping called insomnia, and they might have problems with easy fatigability. They would go to their mailbox and there's huffing and puffing. So as a 20-year-old kid or as a teenager, do you really want to live the rest of your life, at least for the next three to 6 months, living like that, you know, having numbness, having insomnia, because you did not get a shot of the COVID vaccine? You're gonna really gamble your life in, you know, because you have not gotten the COVID vaccine. So it's not really worth it. You're still vaccinated.
Thank you, Dr. Magadia. That was really helpful. I just want to say hello to everybody if you're just joining. Welcome to Senator Tuberville's Facebook Live event where we're discussing COVID and the vaccine. My name's Emily, and I have my colleague Gil here, and we cover healthcare for the senator. We are joined by 3 Alabama doctors, so I'm going to dive back into our next question. This one is for Dr. Ramsey. This is from someone in the state, a parent. Myself, is it safe for him to get the vaccine, or should I wait?
So can you repeat the first part of the question? You said my son, it kind of blocks out.
My son just turned 12 years old.
Okay. So yeah, my heart goes out to parents right now because everybody is trying to do the right thing for their family and for their children. And I certainly understand concerns about the vaccine. You know, the Pfizer vaccine is currently approved down to age 12. The Moderna vaccine, that data is pending and waiting on approval. So those studies were done on thousands of young people, and now millions of doses have been given. I do feel like that the overall safety data on the vaccine is very good. We know it's incredibly effective in young people. Young people have very good responses to vaccines, which is why we vaccinate young children about 2 vaccines, or 2 diseases when they're young. So we know that they respond very well. Almost 100% develop a good immune response. So, and I think the thing to remember is that although children are and young adults are less likely to have severe complications, if your child is that one that has it, it's a big deal. And so we do know that the vaccine, you know, does have side effects, the soreness, a little bit of fever, achiness. Other side effects are extremely rare, but we know it's incredibly effective. So I do feel like it's safe down to age 12.
Great, thank you for that. Dr. Ramsey, I'm going to come right back to you and kind of piggyback off that question.
Sure.
Why can't children younger than 12 get the vaccine?
Okay, so I was just at a conference this week and we're talking about this. So those studies are still ongoing for children less than 12. And part of the major reason is that we want to make sure that the dosage that we need to use in children younger than 12 is right. So we know that children respond very robustly to vaccines. And so we're looking at maybe being able to use even smaller doses of the currently available vaccines in these younger children. So we look for that data to come out probably sometime in towards the end of this calendar year. Hopefully during this school year, we'll have that indication for kids probably from 5 to 12 is the age that we're looking at primarily right now. So that data is still ongoing. So we don't recommend doing off-label vaccination for children under 12, even if they're a big 10 or 11-year-old. We don't recommend that at this time.
Wonderful. Thank you for that explanation. This question right now is for the group. We had a constituent write in saying this: my family and I want to wait so that people who are elderly or have pre-existing conditions can take the vaccine. What do you have to say to a family like this?
So I would just say some of the data that we're seeing is for the elderly population, about 90% of that population has already received vaccine. And we've been encouraging people who have medical problems to go ahead and get their vaccines. So if you're, I think that the sentiment behind that is great and altruistic, but I think the vaccine supply now is such to where it's available for everyone. So I don't think that that's necessarily a reason to delay at this time. I think that the vaccine supply is there. And so, because the elderly went first, which I think was the right thing to do, I think that anybody who wants one at this point should feel comfortable going ahead and getting one, that they're not taking a dose from someone else.
I would add to that it may not be young people that are having serious contact from the virus, but it can be who are carrying the virus, those who are less more comorbid conditions. So certainly, again, as Dr. Ramsey said, the idea was right. The altruism behind their decision was correct. But what a lot of people are forgetting is that with the Delta variant especially, it's very virulent in the extent that it's very contagious. So even those people who have not yet been vaccinated, even though they may not get sick, they could certainly make a lot of those people around them sick. So I would encourage them as well not to hesitate, but for everyone to go ahead and get the vaccine so that we can cut down on the transmission of the virus and less likely to make everyone ill in the future if we can get more and more people vaccinated.
The issue with allocation in the beginning, when we first started rolling in the vaccination with Pfizer and Moderna back in December, January, and later on with J&J, somehow went away. We have a lot of vaccine supplies now. Locally, we have several, couple of thousand doses that are readily available for them. Some clinics even could offer vaccine without an appointment. So you could just roll in there and they will give you a shot. So that issue with allocation is not really a problem anymore. Dr. Ramsey was right, those population 65 and above with pre-existing condition, especially with kidneys and heart and diabetes, that having them vaccinated first was a brilliant idea. And then we started getting the healthcare workers vaccinated as well. But we are not in the tier system anymore. So everybody or anybody, as long as they're 12 and above, and they don't have any medical conditions that their primary care or provider deemed might be contraindicated for vaccination, anybody could get vaccination right now.
Here we go, Dr. Magadia. Many people write and talk about rumors they've heard. To list a few, the COVID vaccine has a microchip. The vaccine development was too rushed to be effective, or the vaccine changes your DNA. Can you address these concerns?
Okay, so there are two things there. And I a lot of these lectures locally. I as a matter of fact, this past weekend, I went to two local churches, and by far and away, those two questions always come up. I do small groups, big groups, and those two things with microchip and RNA. So let me just discuss them one by one. So the RNA, DNA issue has been around since we started talking about vaccination. So especially with the Pfizer and Moderna products, because they use the platform called messenger RNA. So if it's an mRNA and I have a DNA, it's probably going to alter my DNA at some point, right? So I think that's absolutely correct, because for the mRNA does its thing. You have to go back to your biology class in either high school or college. The cell has two major components. One is what we call cytoplasm, which is the full body of the cell, and the other one is the nucleus. So the mRNA vaccine actually does its thing. The mRNA specific which attack with the antibodies, it only does in a particular part of the body called cytoplasm. Your DNA your nucleic acid, your genomic components, everything is in that part of the body called nucleus. So they're not even close to each other. Even if there's a rare chance, a far-fetched chance that somehow that mRNA goes into the nucleus, we as human beings do not have that capacity to make that switch because we do not have that enzyme, that particular enzyme that can do that. So it's absolutely false that it's going to alter your DNA at some point, whether right now, in the next several months or so, or several years. It's not possible because that mRNA does not go to your nucleus. The second question is about microchip, and this is one of my kind of pet peeve because I get asked this question over and have read up there. Hey, this vaccine technology, it's capable of implanting it's be able to track me down. That technology does not exist yet. It's pure science fiction. There is a technology that does that right now, and everybody's aware of that. That's called iPhone or Android phone. They could track you down with your iPhone, but they're not going to be able to track you down with that microchip that they're putting on your vaccine because it does not exist. That technology is purely science fiction right now.
Y'all have talked earlier during this about people's concerns that the vaccine was too rushed in its development to be effective. But I think it was, y'all mentioned that the technology has been around for around 10 years. So I think that also kind of speaks to that point. I think we have time for maybe one more for me to read and one more for Gil to read, but this one could be for the group or potentially just for Dr. Magadia. This question is about the Delta variant specifically. So, do we know the effectiveness of the vaccine against the Delta variant? And isn't the Delta variant what they suspect is causing the breakthrough cases in vaccinated people? So maybe just y'all could speak about the Delta variant generally in your experience.
So currently
Yeah,
we officially have 3 Delta cases in the hospital, hospitalized needing care. We do not test for Delta for everybody. It's a send out that, it's a specimen that we have to send out to Tennessee. But we think that everybody or majority that we have been seeing are probably Delta because the rapidity by which they get sick. There's a thing called incubation period from the onset, from the exposure to the onset of symptoms. Typically, with the original virus, it takes about maybe 4 to 5 days from the exposure to the onset of symptoms, which we call incubation period. It's much quicker, from 2 days. As a matter of fact, we had one patient that we saw that the onset of symptoms were within 4 hours. So we think that, the Delta being more transmissible, people are getting sicker. The second issue is whether the vaccine is still effective. We think all the 3 vaccines that we currently have, they have some protection against Delta. Not as high, the titers are not as high compared to the wild type, but you are still protected against the Delta strain with the currently available vaccines that we have.
Yes, and so I would just echo what Dr. Magadia has said. With the increased transmissibility of the Delta variant, it just again speaks to the importance of vaccinations. Even though there may not be perfect immunity to the Delta variant with the current vaccines, it is definitely better than no vaccine whatsoever. And if we can cut down on the transmissibility by getting the vaccine, there again, we can cut down on a lot of the problems that the Delta variant presents. So it all comes back to the idea of getting the vaccines and making yourself safe so that you're less likely to make those around you sick as well. And therefore, we can address the concerns of the Delta variant by getting the vaccine and making it less contagious to more and more people by getting more and more people vaccinated. And the current vaccine does have some protection.
I think it may also be important to note that your point of care test at your doctor's office and hospitals can't differentiate between, it just says COVID. It's not going to say this is the Delta variant or not, but it will. They are able to detect that there's COVID there. They just can't differentiate between the two. I think that's important. I have people ask me, is this the Delta variant? And at your point of care testing can't differentiate that at this point.
Great. Thank you all for those responses. I have one last question, and it's for Dr. Magadia. CDC is reporting approximately 4,000 deaths and over 160,000 reactions to the vaccine. How do you explain these numbers if the vaccine is safe?
So actually, as a matter of fact, if you look at the CDC website, there is a tab there called VAERS. It's a Vaccine Adverse Event Reporting System. It's actually a self-reporting system. We have reported some adverse events as well. So anybody could go onto that site and report either a fever or a headache or somebody dying from the vaccine. So according to that site, I looked at that this morning. There's about close to 6,000 reported deaths on after we started vaccinating. So we have had close to 150 doses given. So that essentially confers about 0.0019, less than 0.1%. Also, they're saying on that website that they could not really tell whether, Miss Jones there passed away because she had a heart attack or so just after the vaccination. Issue whether it's a direct causation or just a coincidence. So CDC could not really tease that out because it's a reporting system. They're not really capable of teasing out whether it's truly related to vaccine. So going back to the question whether it's really safe, like I've said, we have given close to 150 million doses, and we have seen very minimal side effects. We think it's safe. We definitely think it's effective. So those things, they got kind of cherry picked on a lot of stuff. It's not really something you want to without going to details, especially with CDC just reporting.
Great. Well, thank you so much for that response. And then I will turn it back over to Emily and let her close us out.
Yes, thanks, Gil. We've definitely gone over, so that's all the time that we had for questions. And again, Senator Tuberville, he got pulled down to the Senate floor for votes for what's promising to be a very long day and night of votes on the budget resolution, but he is so appreciative to our wonderful panel of doctors for being here and taking the time to answer these questions today. Hopefully some folks were able to find it helpful. And thank you to everybody who submitted these questions as well. If you had a question that wasn't answered today, please feel free to send it over to our office via either our website, or you can call our front office, 202-224-4124. And that's all we have for today. So thanks again, y'all.
Thank you.
And welcome back to CBS 42 Now. Phil Penarski here. We just heard from a panel of doctors across the state of Alabama in a Q&A discussion hosted by Senator Tommy Tuberville's staff, addressing a lot of concerns surrounding the COVID-19 virus, the vaccine, the ongoing pandemic. Do want to address this box next to me right here. This is, once again, the Alabama Department of Public Health's COVID-19 dashboard, which you can find right now over on our website and see all the latest information being reported by ADPH. Very quickly want to go over some of the key topics. Lots of great information in this doctor panel. We discussed, worries about children as they head off to school and masking. getting the vaccine. Senator Tuberville speaking before, saying that he and his entire family have all been vaccinated, saying that they did this to help better protect everybody around them and also help them survive in case they do happen to contract the virus. They'll have the best chance at fighting against COVID-19. Again, we will have a full report on this over on our website, cbs42.com, in just a matter of moments. And coming up in about 45 minutes, we will be hearing from a UAB pediatrician, regarding COVID-19 and children, again, as they head off to school for the upcoming school year. That will be coming up at 1:30 over on cbs42.com and right here on CBS 42 Now. I want to thank you all for joining us today on this latest edition of CBS 42 Now. I'm Phil Penarski, and we hope you have a great rest of your day.